Medical Watch here. The key to better sleep may be time.
But as medical reporter Dina Bair is here to tell us, it's not about time in bed. Dina.
Ben and Lourdes, time management during awake hours may contribute to better sleep, according to a new study. University of Alabama environmental scientists sought to figure out why college students experience such poor sleep. Lack of sleep can have both mental and physical impacts. They found organization, scheduling, and overall time management enhanced sleep health. Students who slept better also had fewer bouts of anxiety and stress. All brains are not the same. Cambridge scientists reveal the hypothalamus, a key region of the brain involved with controlling appetite, is different in the brains of people who are overweight and obese compared to those who are healthy weight. About 2/3 of adults are overweight, and that increases the threat for many health problems like diabetes, heart disease, stroke, and cancer. Genetics, hormones, and environment impact how and what we eat. Add to that a unique brain structure that may hamper the brain's ability to help people regulate eating behaviors by alerting them they feel full. Doctors say they're not sure, though, if the structural changes in the brain are a cause of overeating or a consequence, since a high-fat diet can lead to inflammation, which may alter the brain. People with autism are more likely to harm themselves and attempt suicide than non-autistic people. Experts say the risk is so great, mental health experts urgently need to come up with ways to ease that threat. Autistic females have an 83% increased risk of self-harm, according to the Center for Addiction and Mental Health. Autistic males have a 47% greater risk for harm, and they had the highest incidence of suicide death. Study authors say this is a wake-up call to help those with autism. Since people with autism are often forced to mask their struggles due to traits that others don't really understand, tailored mental health support services all really crucial.
Okay, quite the warning. Thank you so much, Tina.